presented by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, heart health. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. High cholesterol, high blood pressure, excessive weight, and a sedentary lifestyle are just some of the risk factors for developing heart disease. It's the #1 killer of American men and women, and experts say that our children are even more at risk than we are. How are heart problems diagnosed? What can you do to keep your kids healthy? What are the latest treatment options for blocked arteries? We'll get answers to those questions and more tonight from our two guests, Dr. Anthony Morise, a cardiologist at WVU, who specializes in diagnosis of heart conditions, and Dr. Malek Yaman, a pediatric cardiologist at WVU, who specializes in caring for children with heart problems. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Tony, for sure, lifestyle factors weigh into who's going to develop heart disease.
Yes, factors such as activity, sedentary lifestyle, diet, big problem, as well as habits that people pick up, such as cigarette smoking. Those are probably the biggest ones that people have actually control over in their lives. They can start off by eating a poor diet, have poor activity habits, and start things such as smoking, which definitely will have an impact on their life and their heart health later in life.
So these are all things that people do that lead to heart disease. But Malek, you and I are pediatric cardiologists, and we deal with patients with congenital heart disease. What's the difference?
So congenital is something that you're born with. So when we say congenital heart disease, it's really a big spectrum of problems. It could be something very minor, like a hole in the heart. A lot of these things can be watched and not necessarily have something done for. But on the other end of the spectrum, there are things that are very complex, like a missing valve or a very underdeveloped pumping chamber, and those are things that definitely would require a lot of complex surgery and things like that. But these are things that are just present in about 1% to 2% of live births, and it's nothing that people did or nothing that mom ate or did during the pregnancy in most of these cases.
But now our two fields are starting to cross over more because patients born with congenital heart disease are actually living into adulthood as well. So they have those lifestyle modifications that they'll need to think about as well. So what would you say that the #1 symptom is that you see or adults should be concerned about with their health?
The #1 symptom clearly is chest discomfort or pain. Some people don't have pain. They'll have some kind of a symptom that is unpleasant in their chest that they have trouble putting words to. I'll just say it's like a smothering or a pressure or a weight on their chest. And that could be a symptom of heart disease. It doesn't always have to be heart attack type disease, but heart disease can present in that way with chest discomfort. The other second common symptom is shortness of breath, which overlaps with lung disease as well. But shortness of breath can be a secondary symptom of heart disease.
Is there something specific about the chest pain that someone should be watching out that would lead them towards it being the heart instead of the lung?
It can be a very vexing problem to track down, but typically heart pain, it comes on with exertion and is relieved by rest. And typically can be anywhere in the chest, anywhere from the top of above the belly button up to the angle of the jaw. So you really can't pin a location, but the classic area is right in the middle of the chest.
And for sure, if someone has that, they need to see their doctor soon.
Sure.
Now, young folks, adolescents, and teenagers, they have chest pain quite often. You see that in your office a lot. What's the difference between their chest pain and an adult with chest pain?
Right, so it is a very common symptoms in growing children and teenagers. And I guess the happy part about our specialty is that most of these children do not have a heart problem. At the end of the day, we reassure most of them that, in fact, their chest pain is non-cardiac in origin. Over 95% of these kids are going to be perfectly normal from a cardiac standpoint. So things like chest wall pain from the ribs or ligaments in the chest can cause chest pain, asthma, acid reflux. But really our job is to sort throughout their symptoms, and just like Tony said, we have to really get a good story about what is exactly the chest pain like, what is causing it, what are some of the relieving factors, and a lot of times just by a good story we can sort out what sounds like cardiac chest pain and what doesn't.
Okay. Now the workup is about the same? Where would you start with a patient with chest pain? What do you think they need?
It kind of depends on what kind of baggage they come along. If they come with a lot of factors that would play into, say, coronary artery disease, hardening of the arteries, it's like if they're diabetic, if they smoke, then we would have a much higher suspicion, and we might move them right up to the top of the lane and go right to the catheterization lab. For people where the concern is not so great, then we have these non-invasive stress tests that we do of a variety of different types, all the way from the simple treadmill EKG to very complex imaging procedures that we do to try to see the heart in more direct depth.
Okay. Our first caller is Ed from Fayette County, Pennsylvania. Ed, welcome to Doctors on Call. Do you have a question?
Yes. Here a while back, I had all my arteries checked in that large area where they put you in there for a couple hours, and my report said I have left ventricle fracture 61%.
Okay. So I think what Ed may be referring to is his
ejection fraction, as it's referred to. That's just the fraction of blood that's contracted with each beat. And 61% is actually in the normal range, Ed, and usually anything below 55 is considered abnormal, and then the further low it goes from there, the more abnormal. But 61% is normal.
Okay, so what Ed was talking about is an echocardiogram and looking at a way of quantitating the function of the heart. Can you tell us a little bit about that?
Yeah, so it's basically ultrasound. So it uses ultrasound technology to look at the heart muscle, make sure that everything is formed correctly as far as the heart valves, the muscle, and then we also quantify function of the heart using different techniques. One of them is the simple measurement of an ejection fraction, or how much of the blood is ejected with each heartbeat. And ultrasound has really revolutionized the way we do both pediatric cardiology and adult cardiology, because it's very portable, it's non-invasive, and it really gives us a very good look at the heart in most cases, I would say.
Okay, very good. Well, good luck to you, Ed. Our next caller is Phyllis from Lawrence County, Ohio. Phyllis, welcome to Doctors on Call.
Hello.
Hi, go ahead with your question for our experts.
I have been told that I have a heart murmur, and I was wondering what causes them.
Excellent question. You want to start, Tony?
Heart murmur is the flow of blood that is audible, that you can hear with a stethoscope generally. The physician will hear it. It generally will not be audible or heard by the patient themselves. And a murmur can be, in most cases, totally innocent and benign. On occasion, we do find a murmur that really means something serious in terms of a heart disease. But that's the big $64,000 question when they come with a murmur. Is it something serious, or is it something innocent?
And what are some of the things that cause heart murmurs that are serious?
Most commonly, it's a valve problem. It can be occasionally congenital heart disease that presents that way. There are some heart muscle disorders that can present with a murmur. And those are the major ones.
Okay. So Phyllis needs to start by having her doctor figure out if this is an innocent murmur or truly a pathologic murmur. Now, in pediatric cardiology, you see patients with murmurs probably even more often than adults. What do you see in your clinic?
Yeah, and the way I explain it to the families and to the parents is that a murmur is not a problem per se. It's just a sound we hear. And in most cases, it is just an innocent flow murmur. And the reason it's more common in children is that they have very thin chest walls. So when we put the stethoscope on their chest, it's very close to their heart, and we can hear a normal flow of blood in normal structures, vessels, valves. And as they grow older, a lot of these innocent murmurs fade away because we can't hear them anymore. Some of the causes of murmurs in children are most common causes an innocent flow murmur. Other causes are either holes in the heart, like a VSD or a ventricular septal defect, which is a defect in between the two pumping chambers, or a leaky valve, or a stenotic or obstructed valve. These would be the most common types of pathologic or abnormal murmurs.
Okay, so if either of you here have a patient with an abnormal murmur, you're going to go to some more advanced imaging to figure out what it is. Janice from Putnam County is our next caller. Janice, welcome to Dr.